Do you want to be healthier, yet you just don't know what to do? All these shows telling you this and that, but nothing seems to work. Well, listen close. Golden State Media Concepts has got something great for you. The Health and Wellness Podcast dedicated to workout trends, healthy eating habits, diet, and everything about healthy living. Join us in our banters as we help you not just live life to the fullest, but live it to the healthiest.
Hello and welcome to the GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I am your host, Heidi, and today I'm joined by the wonderful Sarah.
Hello.
Sarah, do you ever feel like, you want younger looking skin and a boost of vitamins?
Yes, right now. Can we just fix the dark circles under my eyes magically?
I mean, that's what I'm thinking for myself as well, if that could be worked out. But see, when I think of those things, I don't think of an IV drip.
What?
Yeah, exactly.
I know when my husband was sick once and very dehydrated, they gave him they call it a banana bag. It was full of all sorts of great vitamins and nutrients and all that stuff. And they called it a banana bag because it literally looked like Mountain Dew in an IV bag. So that makes sense to me. But just for every day, do people do this?
Yes. And that is what we're talking about, because I had the same reaction when I'm like, yeah, of course, better skin, vitamins, sounds great. And then it's like with an IV drip. And I'm like, does not sound as great as I was hoping. I have questions. I don't want to do that.
I have questions. I have initial judgments. That mostly because I have questions. Yeah. So I'm just going to let you
I have answers.
Tell me about it first before I start asking questions.
All right. Well, let's see if I can provide some answers, because I'm also a bit confused.
Yeah.
Okay. So you might have heard about this. I have heard about it, and I think it's a bit strange. Like Sarah, I also think it's a bit odd. But if you're thinking about vitamins, you might want to try an IV drip, because it's a craze that is going on right now. And people are saying things like you can get healthier skin, you can boost your immune system, even that you can cure like a hangover.
Now I have heard that.
Oh, really?
Yeah.
Like a really bad hangover, you would go to the hospital and get an IV drip?
I read about it. Now, see, okay, this is terrible, because now I can't remember if I read about it like in a novel and it wasn't real. But I have heard about like an IV concoction that can help with hangovers. And I suppose there's probably something that would help maybe.
Yeah.
But I guess my initial question is how? I mean, where do you go to get these magical IV infusions?
Oh, yes. Okay, that is a good question. So because this treatment has gained a lot of popularity, like it's even been like A-list celebrities like Rihanna and Adele have been backing it. Mm-hmm. I feel like because of that, it has popped up in a variety of storefront type things, like places that are like spas for wellness, or people who will just come to your house and, give you an IV drip.
I don't trust that. Should I trust that?
I don't know. I mean, okay, so I'll probably get to that in a bit if you should actually trust this. But I feel like because I'm seeing that, I ask so many questions like, is this legitimate? Is this going to harm me? Do these people know what they're doing?
Right. Should I invite a stranger into my house and invite him or her to stick a needle in my arm?
Exactly. So because of that, I wanted to look into it. I hope that we can find some answers. I'll talk about whether it seems legitimate or not. I want to start off by talking about what it is. So basically, the first IV vitamin drips, they were developed and administered by Dr. John Myers, and this was in the 1970s. Okay. And his research led to the popular Myers cocktail, which consists of magnesium, calcium, B vitamins, and vitamin C. And these are types of infusions that can take anywhere from 20 minutes to an hour. And typically, at least they're supposed to, take place within a medical office with a licensed medical professional who is observing the infusion, which is related to like if you go to a hospital and, you know, people get IV drips, kind of like that. But it sounds like this type of like Myers cocktail that's not just when you're in the hospital super dehydrated. It sounds like this became sort of what we know now is like a popular thing of people who are getting it in places that aren't just the hospital or just a doctor's office.
Right.
Which is interesting.
Okay.
So I guess then you have to think about like what's happening when you get an IV drip of vitamins, like what's going on in your body. And while you're undergoing an IV drip, what's happening is your body is receiving a higher concentration of the vitamins themselves. Mm-hmm. So a vitamin that's taken by your mouth gets like broken down in your stomach and digestive tract. And therefore, it's kind of like limited how much can be absorbed. Typically, your body absorbs like 50%.
And it probably takes longer.
Yes,
okay.
Yes. And hence the idea that if the vitamin is given to you through an IV, it's absorbed at a much higher percentage, like 90%. Mm-hmm. And of course, you know, it is quicker because it's going straight into your bloodstream.
Right.
So when a person receives an IV vitamin treatment, they're receiving a liquid mixture of vitamins and minerals, which, of course, as we know in IV, is through a small tube inserted into your vein. And this will allow the nutrients to be absorbed quickly, directly into your bloodstream, and it produces higher levels of vitamins and minerals in your body than if you just got them from food or supplements.
Last week we talked about fat and water soluble.
Yes.
How does that work with when it's just right into your bloodstream?
I don't know, because I feel like it would still have to cycle through your body somehow, you know?
Yeah,
like if you got to, like your body would still be, I don't know what the right word is, ridding itself of extra.
Right.
You know.
Somehow. Yeah,
it's interesting.
I don't
because
know.
we did talk about vitamins previously, like ones that you might take like orally.
Mm-hmm.
And I feel like in that episode we talked about how a lot of healthcare professionals suggest just having a healthy, diverse diet to get your vitamins. And I do want to say, after looking into this, a lot of healthcare professionals said the same thing, as opposed to just like going straight for an IV drip.
Right.
They were saying you could also just eat a well-balanced diet.
Or there's that.
Right. There's the other method that we've been doing for quite a long time. So,
Okay.
I don't know. I mean, there are many factors that affect your body's ability to absorb nutrients. So, whether you're eating, you know, a diet and getting vitamins that way, or taking them orally, or taking them through an IV drip, there are other factors that contribute to how your body takes them in. So, like age, metabolism, health status, genetics, like other products that you're taking, and also like your physical and chemical makeup of the supplements. So it can all vary on how your body takes it in and presumably how it gets rid of it. Higher levels of vitamins and minerals in your bloodstream do lead to greater uptake into cells, which theoretically will then use the nutrients to maintain health and fight illness. So in theory, it's like it helps your body take in more and your cells and whatnot.
Right.
Which is generally probably why people like it. Also, there are variations of IV treatment that have been described by, you know, doctors and qualified nurses over a century. And the reason we do that is because it's a quick and efficient way to deliver fluids or medication into your body.
Right.
Yeah. Like at a hospital. Like, again, like if you're dehydrated or something.
Sure.
It's like how you get fluids into your body. So typically, in a hospital, a pharmacist will mix the solution per a doctor's orders, and then a nurse or healthcare professional will then be the person to put it into your body. Also, to take into consideration, like in a hospital, if you're getting this while you're dehydrated, it could take a couple of attempts to, you know, find your vein, and that's the same thing that can happen if you're just getting an IV drip.
Yeah.
Yeah, so it could be a bit difficult.
Especially if you're dehydrated. I
Yes,
mean, you know,
exactly.
I would assume if you're going to do this, you'd probably want to hydrate really well beforehand to make sure your veins were present. But
I agree. But if people are taking it for like a hangover cure, you might not be hydrated.
No.
You know? Which also is interesting. Like, does that mean you plan to get really drunk and hungover, so then you order? Like,
right, you order it ahead of
prepared to do
time.
this? Or is it like a last minute, like, I need to go get an IV drip vitamins? Like, that's like a whole, that's like a TV show level, like,
Yeah.
health craze. Like, I feel like I think something like this happened. I saw a similar related craze where people weren't just getting vitamins, they were getting younger people's blood.
Oh, dear.
Yeah.
Oh, wow.
So I saw that in the news, and then it's also on a funny show called Silicon Valley. But like that's like that. I was like, I'm not going to look into this.
How vampiric, yeah.
But for those, I would say from the headlines that I've read, it's probably not very helpful.
Mm-hmm. And potentially dangerous.
Yeah, exactly.
Wow.
Exactly. Also, I want to mention before we take a break that when you get an IV drip at a hospital, a nurse or healthcare professional will monitor that. So if you are thinking about getting this just for not hospital-related reasons, make sure you have someone monitoring it because that's how it's supposed to happen.
Right.
So I'll also talk about what you should look for if you're trying to get an IV drip, but I just want to say that now if you're like looking it up online, please make sure it's a place that's qualified, that has someone who's going to watch you. It's very important.
Yeah.
Yeah. So we're going to take a quick break and then we'll be right back and keep talking about IV drip vitamins.
Still on the search of that one true love? On the limbo in this crazy world of dating, marriage, relationships? Well, listen to the Golden State Media Concepts Relationship Podcast, your one-stop podcast for everything about relationships.
Welcome back to the Health and Wellness Podcast. We are continuing to talk about intravenous vitamins.
And I am continuing to have many questions.
We're still confused.
I'm still skeptical, I think.
Yeah, I'm still scared of needles, so I will never be getting
I
this.
don't have a problem with needles, but I am a little skeptical of this.
Yeah, I mean, many people are. Okay, so to continue about IV vitamins, like what kind of person or health concern would benefit from getting this?
Yes.
Besides, like, I'm just hungover and I need this. There could be other health concerns. For instance, like the vitamin infusions could be used if maybe you have someone like with asthma or migraines. And amongst other things that have responded well to the Myers cocktail treatment, also chronic fatigue syndrome, fibromyalgia, muscle spasms, pain, allergies, and sinus and respiratory tract infections.
Okay, but again, I feel like these are things that you go to your doctor for.
Yep.
I mean,
Yep.
I have migraines, and I still feel like if it was so severe that I needed an IV, I would want to go to an emergency room or an urgent care.
Right.
I guess it would be nice if somebody would just come to me because nobody wants to leave the house with a migraine. But I don't know. I still feel kind of iffy about it.
Yeah, I would agree. I mean, I think if maybe you have some of these things, it has been shown this particular cocktail of vitamins can help. Mm-hmm. But I mean, again, I'm kind of with you, Sarah. I really feel like if you're dealing with this, you should probably go see a doctor. And it could be that then your doctor might actually okay this type of treatment, you know, with someone that they know and trust. That's possible.
Right.
You know.
I guess if that were the case, if my doctor said, yes, this is something that you should do, here's the address of a place to go, and it's a
Right.
reputable kind of medical clinic type place.
Yeah, I agree. Also, along with these things, if there's like someone who can't eat enough food or who has an illness that intervenes with nutrient absorption, like those could all be, I would say, legitimate reasons to consider maybe IV vitamin therapy. Again, if it's at a place that's trusted. Mm-hmm. Also, there are other uses for IV drips, like, again, dehydration, and that can be from extreme exercise or alcohol intake. Also to boost the immune system and apparently to increase energy levels. It is important to note, again, that if you're healthy, you probably get these nutrients from a balanced diet. So if you're a healthy individual and you're not dealing with these other symptoms and things, really the long-term and short-term benefits of IV drips are a little bit questionable.
And I don't feel like we should use I keep going back to using it for a hangover. I don't feel like you should be like, woohoo, I can drink to excess because I can just get this vitamin IV.
Yeah, that's a really good point.
Don't risk alcohol poisoning just because you think you have a hangover cure.
Yeah, that's a good point. Very true. Very true. This is not going to save your life, if you're on the brink of alcohol poisoning.
Yikes.
It's not how it works. There are other popular reasons why people get IV treatments or IV vitamin treatments. Some of the popular ones are like to relieve stress, rid your body of toxins, balance hormones, boost immunity, and make your skin healthier. There are anecdotal claims that are positive about like feeling rejuvenated, but there's not really hard evidence to support these claims.
Okay, that was going to be my follow-up question. Besides anecdotal, which I'm sure there's plenty.
Right. And also related to when we were talking about vitamins, the water soluble or the fat soluble, the vitamins that are used in IVs are water soluble. So once your body uses them, they will leave your body.
Okay, I guess that makes sense then.
Yeah. So, I mean, again, your body's not going to take more typically than what it needs. So you might just be if you're healthy, you might just be taking in a bunch of vitamins that you kind of already have.
Right.
And your body's just going to cycle through it.
Your body's going to flush them out, right?
Yeah, basically. So what kinds of vitamins and minerals would work best for the IV?
All the B's.
Yeah.
I just remember all of them being water soluble.
That's true. Yes. There are, like 12?
You kept saying B5, water soluble, B whatever, water soluble.
That's what I learned from
I was paying attention, at least to that part.
Oh, thanks, Sarah.
Yeah,
that
sure.
means a lot. I'm gled you paid attention through all of the B vitamins because there was
a lot of them.
That was an uphill climb. Okay, so if you're talking about the vitamins, yes, probably the B vitamins. Also, there's not really a limit to what vitamins can go into IV therapy. You can use, sounds like, basically all of them that can go into your body through this method. The best vitamins for the treatment are the ones that are natural to your body's, like to a person's body. And like, you can kind of like measure that before you go into this. Like if you're going to see your doctor, they might be able to tell through other tests if you're vitamin deficient in anything. And then potentially an IV treatment for that particular vitamin could be helpful. The common ingredients though, just for, if you're just getting, your garden variety IV vitamin drip, the typical ones are vitamin C, the B vitamins, of course, magnesium and calcium, and they can also contain amino acids, which are the building blocks of protein, and also antioxidants, and one that I did not recognize called glutathione, which is a vitamin.
I think I remember seeing that word when we were talking about vitamins, but I don't remember which vitamin it was, because, they all had like 6 names.
Yeah. I mean, I believe it's a vitamin. It could be in your IV drip. You never know. Okay, so we do need to talk about if there are risks. Because, also I have to say, if people are talking about getting IV drips, I kind of think it sounds a little bit for, what's the right word? Like vain reasons.
Right. If you're going for looking younger or having, quote unquote, younger looking skin. Can I ask you a quick question before we talk about risks? So when you were talking about the vitamins that go in and then you said amino acids, I know a lot of people use those as part of a workout routine. So do people do vitamin IVs as part of like working out or bodybuilding or any of those things? Did any of that come up?
I have actually seen some of that. I don't know, not just related to exercise, but I have seen it actually come up on social media. Like people who are typically people who are more into like the wellness scene have probably given it a try. People who are like in an active lifestyle, because this can again be used if you're dehydrated. So I guess if you're working out a lot and you want other liquids into your body, or I guess I could see it if they're putting amino acids into your body for workout reasons.
I was just curious if that came up as again, probably more anecdotal if people were talking about that. So.
Yeah, I didn't see it, but I mean, yeah, I think if people hear about it, that could be a potential. It looks like there were a fair amount of clinics in different areas, so maybe people go for different reasons, like casually, which sounded kind of like you were just going to like pick up a coffee, like you're just going to go get an IV drip after your workout. maybe. But also, if you're working
Instead
out,
of a juice bar, they're gonna have like
Right.
little areas for IVs.
that's what I was like thinking about it, like a Jamba Juice type thing.
like the wheatgrass and the
Right.
except hopefully you're not putting wheatgrass in your IV, but you know what I mean.
That'd be a terrible idea. But I guess, I don't know. If you're working out a lot, you might be kind of dehydrated, and then you probably wouldn't want to get an IV drip at that moment. You know? I don't know if maybe maybe you want to do it before a workout. I'm not sure.
I don't know. Interesting question.
Yeah, I don't know. I mean, I'd be interested to hear anecdotal stories.
Yeah.
Okay, so some of the risks. So there is a risk of infection with IV vitamin therapy because anytime you have an IV inserted into your body, it goes directly into your bloodstream, which of course is bypassing your body's first defense mechanism against bacteria, which is your skin. Mm-hmm. So the risk of infection is unlikely, but it's important to consult with a licensed medical professional who will perform the therapy to manage the risks and ensure that you have a good, healthy vitamin infusion. Because, I mean, again, if you're just going to anyone
Right.
at like a strip mall.
Right.
Like,
Although I was just thinking that, and then I'm like, but we let lots of different types of people tattoo us, which is also
That's
needles
true.
into our skin. Not
That's true. Maybe it's something that just over time will become.
more common.
Yeah,
And
potentially.
maybe more regulated.
Yeah, that's another thing about
Yeah.
the regulation.
I-
But yeah, that's true.
I would
guess.
definitely be vigilant in watching what they're doing. You know, are they taking the proper precaution? Is everything
Right.
sealed? Like when you go to a doctor
Yeah.
and they have the bleh, I can't talk. You know, they have the little packets of things that they open that everything's sterile.
Yeah, I agree. I think I also kind of connected to like, well, if you're getting like a manicure or something, you know, you're like trusting that people aren't going to like cut you. I mean, this is
Right.
a little bit more extreme, but
Right.
you know, like people have to have licenses,
Yeah.
which I think will be something that will be growing
Yeah.
as potentially the trend increases. But we're going to take a quick break and then we'll be right back and keep talking about IV vitamins.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter and download us on iTunes, SoundCloud, and Google Play.
Okay, so we are continuing to talk about IV vitamins and
Risks.
Yes, the risks. This is what I just keep thinking about is the potential risks.
Yeah.
I can't really not think about it. Okay.
And
so,
again, maybe in, I don't know, a generation, this will just seem normal and people will be like, what were
yeah.
you freaking out about?
yeah,
We're
maybe.
just-
Yeah.
It's kind of newish, so.
Yeah, my kids will just think I'm like unhip because I don't go to the local IV drip
Right.
place.
You'd rather go to the local Jamba Juice and they're like, pfft.
Yeah, who does that anymore? Let's get it straight into our bloodstream.
Right.
We don't need wheatgrass. Straight vitamin C. But yeah. Okay, so if you're thinking about risks, again, it's important that you want to be careful where you're going because there is a slight risk of infection. So when you're going to any place, do your research. You want to make sure that you're going to a licensed medical professional who will perform this. Also, there is a risk of getting too much of a good thing with IV vitamin drips. So it's possible that you could receive too much of a specific vitamin or mineral, which could increase the risk of adverse effects. So, for example, like people who maybe have kidney disease, that because of that, they can't remove certain electrolytes and minerals from the body very quickly. So adding too much potassium too quickly could potentially lead to a heart attack.
Oh, geez.
Yeah.
So, but I'm hoping if you have kidney disease that, see, again, this leads to the whole question of where are you going and what kind of questions are they asking beforehand, and are they taking a medical history?
Yeah,
I would hope
agree.
so.
Yeah. And that's another point too. You should, like, if you're going to a place, bring your medical history with you.
Yeah.
Also, you should probably be aware if you have, I mean, you can't always, maybe this could be the incident that makes you aware of your
Right.
kidney disease. But
Oh, I hope not.
yeah, hopefully you're aware of it. Also, people with certain heart or blood pressure conditions can be at risk of a fluid overload from an infusion. And in general, excessive levels of vitamins and minerals can be hard on your organs, and you really shouldn't take it to excess, because your body has to function and like filter all of that out.
Right. Right.
Risks associated with an infusion in general can include blood clots, vein irritation, and inflammation, which of course could be painful. And that's not just if you're going to get like an IV vitamin drip. It could be at the hospital.
Yeah.
It could be a bit painful. Also, if the infusions are not being carefully monitored, and if the fluid drips too quickly, there's a risk of fluid overload, which could affect electrolyte balance and damage the kidneys, brain, and potentially the heart.
Oh, jeez.
So, again, do your research.
Yes.
Okay, so what should people look out for? What should you keep in mind if you're just, you're considering IV vitamin therapy? If you want to try it, you should look for a reputable doctor who will be the one monitoring and providing the infusions. So no matter where you're going, if you're going to a place like I saw a website for an IV vitamin place, and it looks like they also were doing Botox at their location.
Okay.
So not necessarily just a doctor's office. And if you're going to a place like that, you want to make sure that the people who are working there are qualified, that an actual like doctor or qualified nurse will be the one doing the IV, like there would be in a hospital.
Right.
So, no matter what the place looks like on the outside, just make sure you're doing your research and don't just assume, don't just assume they all are certified.
Right, exactly.
Right. And also, probably related to that, you might want to read some reviews of the clinic.
Review the reviews, if you will.
Yes. I mean, Yelp has everything. Or just Google.
Yeah.
People will talk about it.
Yep.
They will.
Yes, they will.
Also, in general, and I feel like this just goes for anything, even if you're getting like a manicure, the place should be clean. The people who are dealing with the IV, they should be washing their hands. They should wear gloves. And of course, their gloves should be changed every time they meet a new client. Also, it's probably a good idea if you're going to these places to be able to provide a comprehensive medical history. So, to avoid the kidney thing. And really that should include health concerns that maybe you've encountered over the course of your life. Also, any medications that you're taking or recently have taken. Prescriptions, even over the counter.
Well, especially over the counter. I mean, if you've just taken a handful of vitamins and now you want a vitamin IV, that could cause problems.
Yeah, that's a really good point. Also, even like dietary supplements, if you're taking like special, even like, special teas or something like that. Like anything that you're taking for wellness that could include a lot of vitamins and just other things.
Yeah.
They might want to be aware of. Again, assuming they're a good doctor. They're able to assess this.
Know what the interactions might be.
Yeah. So do your research. And also, if you are thinking about it, maybe talk to your primary care doctor. See if IV therapy is good for you. Maybe ask if you should have any specific vitamins, given to you if you have a vitamin or mineral deficiency.
Which ones you might want to avoid. Like,
right.
If I would like this cocktail, but please do not include the XYZ vitamin.
Yeah,
I don't know if you can specify.
Yeah, I don't know. Maybe they have pre-mixed cocktails. I'm not really sure. Which, honestly, I think I would trust more if it was coming from like a pharmacy and they were pre-mixing rather than like on the premise. Someone was just like...
Yeah, I mean, I guess it depends on
who
who was mixing the cocktail. If it was someone who knew what they were doing, I would prefer it to be specific to my needs.
True.
But if it was just like Joe Blow off the street. Yeah, give me the premix that was mixed by a professional.
Yeah, that's very true. Depends who's doing it. And again, talk to your doctor. If you have any health concerns about it, they might be able to help you out.
Yeah.
Just to avoid adverse reactions to the procedure. And again, make sure whoever is giving you the IV should be a doctor, and they should be board certified, and they should be aware of any health concerns or conditions. Like if you're going anywhere, people need to be aware. Like, go to the dentist. I tell them I have sensitive teeth. It's important that they know.
Yeah.
Okay. So in the overall, the final summing up. Okay. There have been a few studies that have tested the effectiveness of IV vitamin therapies. There's not really any published evidence to date that supports the use of this therapy for serious or chronic diseases. But there is anecdotal evidence, so individual patients may claim that it has been beneficial to them, which, I feel like that's going to be for a lot of any sort of wellness trend.
Yeah.
Not that I'm saying it's just a trend. If you do it, that's fine. But, it could come and go.
Yeah, but there's always that's why things become trends, is because there's anecdotal evidence, and somebody with the following of some kind says that it's great, and then people want to know more.
Yep, very true. Also, I want to mention these treatments are usually not covered by insurance, and they can be pretty pricey. So I would say on average around like $100 per treatment. I've seen online anywhere from like $95 to $200 for an IV treatment. So consider that.
Yeah.
Again, insurance probably won't cover it. So just to be aware. Again, do your research. I personally would say, sounds like the results are anecdotal. If you want to go for it, consult with your doctor beforehand. Make sure you do your research. And it probably isn't going to hurt you. Just, make sure you're aware.
Except that it could.
Not
to be cynical, but
it could.
It could.
If you're not,
I guess anything could.
That's true. If you're not aware of your medical history, don't do it.
Yeah. Yeah.
Like if you might have some like potential issue, like with kidneys or something like that, don't go. If the place looks sketchy, just leave.
Right.
Just don't do it. It's fine.
It doesn't feel right. Don't do it.
Yep. Very much agreed. Don't do the peer pressure IV vitamin therapy. I don't know what group you're with.
I don't know who's pushing you to do that, but don't.
Just, beware. Okay, that brings us to the end of the episode. Thank you all so much for listening, and please tune in to the next Health and Wellness podcast.
You've been listening to the Golden State Media Concepts Health and Wellness Podcast, part of the Golden State Media Concepts Podcast Network. You can find this show and others like it at www.gsmcpodcast.com. Download our podcast on iTunes, Stitcher, SoundCloud, and Google Play. Just type in GSMC to find all the shows from the Golden State Media Concepts Podcast Network, from movies to music, from sports to entertainment, and even weird news. You can also follow us on Twitter and on Facebook. Thank you, and we hope you have enjoyed today's program.